Blood pressure control and cardiovascular disease prevalence among patients with hypertension residing in rural communities in Thailand, a nationwide cross-sectional study in 2024. This is also called the HACRIT study. The collaboration between the Division of Epidemiology and Community Health, University of Minnesota School of Public Health, USA, and the Phramongkutklao College of Medicine in Bangkok, Thailand, establishes the study. The principal investigator of this study is Dr. Bunsub Sakbunirat, a PhD student in epidemiology at the Division of Epidemiology and Community Health at the University of Minnesota School of Public Health. The project advisor is Professor Dr. Kamakshi Lakshminarayan, a professor at the University of Minnesota School of Public Health. We are fortunate to have the collaboration of Dr. Rangzan, a professor of epidemiology at the Department of Military and Community Medicine, Phramongkutklao College of Medicine in Thailand. The research team in Thailand also consists of Professor Dr. Matirat Mungtan, Assistant Professor Dr. Kanlaya Jongcherdchutrakul, and Dr. Jataron Puviang. With experience in community-based research, the research assistants at Phramongkutklao College of Medicine, including Malada Tanarupakorn, Chenchira Kosik, Yapavati Sinthuket, and Siriporn Dokmijin, play a crucial role in ensuring the smooth execution of this study across 4 geographic regions. Uncontrolled blood pressure can lead to serious conditions like heart disease and stroke. According to the 2018 Thailand Diabetes Hypertension Study, 66.6% of Thai patients with hypertension had their blood pressure under control. However, the study didn't include patients receiving care in rural areas. Around 7 million patients with hypertension in Thailand reside in rural areas. However, limited knowledge exists about these patients' clinical outcomes, cardiovascular disease risk factors, and cardiovascular health status. Thus, we propose a study in geographically diverse rural areas of Thailand to better understand hypertensive patients' outcomes, including blood pressure control, CVD complications, predicted 10-year CVD risk, and cardiovascular health. We aim to achieve 5 primary objectives. Firstly, we will evaluate the prevalence and associated factors of blood pressure control among patients with hypertension receiving continuous care at primary care units in rural communities in Thailand. Additionally, we will assess the prevalence of CVD and CVD risk factors among this population. For the 4th objective, we will evaluate the predicted 10-year cardiovascular disease risk using the 2019 WHO CVD risk chart in patients with hypertension who have no history of CVD. Finally, we will assess cardiovascular health among hypertensive patients in Thai rural communities. A cross-sectional study is conducted from June to December 2024. The target study population is Thai patients with hypertension aged 20 years and over who receive continuous care for at least 12 months at primary care units in rural communities. Patients with HTN will be identified based on their medical records, specifically the ICD-10 code I-10. Patients who started receiving care at the primary care unit after the 1st of June in 2023 will not be considered for this study. We employ a multi-stage sampling approach, which includes Stage 1 sampling of 14 provinces, Stage 2 sampling of 18 districts, Stage 3 sampling of 36 PCS, and Stage 4 eligible sampling selection. The sampling unit for Stage 4 is Thai patients with hypertension at the PCU, and the sampling frame will be the list of eligible patients at each PCU. The total of sampled participants is 1,020. A total of 1,020 sampled patients are invited to participate in the study. The participants are recruited from the PCUs located in rural communities. A study coordinator explains the details of the study to the eligible participants, and they are given the freedom to decide whether to participate in the study or not. Eligible participants who decide to participate in the study provide written consent. During the summer of 2023, we engaged with healthcare providers and clinic leaders at 36 primary care units nationwide across 4 regions to strategize on primary data collection in rural areas. We are thrilled to announce that all 36 primary care units are committed to collaborating with us and are fully prepared to support the study. In the northern region, we have secured the participation of 8 primary care units spanning 3 provinces, Chiang Rai, Mae Hong Son, and Lampang. In the central region, we have garnered the support of 8 primary care units from 4 provinces, Siquijao, Ratchaburi, Saraburi, and Suphanburi. In the northeast, we have gained the cooperation of 12 primary care units across 4 provinces, Ubon Ratchathani, Kalasin, Najan Phanom, and Nong Bua Lampu. In the southern region, we have enlisted the involvement of 8 primary care units from 3 provinces, Surat Thani, Trang, and Songkhla. Data is collected at 36 PCUs across 4 regions by a single research team led by Dr. Sakbunirat and 4 research assistants. Each team member is responsible for specific aspects of data collection for all participants. The timeline outlines the data collection plan across the country. In June, we conduct a practice session to prepare the research team for effective data collection and to ensure the validity of measures. The data collection is scheduled between July and November, with December as a flexible period for any additional data collection needs. The data collection process consists of 3 components: a face-to-face interview, a review of medical records, and physical examination and laboratory testing. For the face-to-face interviews, we give participants easy-to-understand questionnaires and visual aids to assist them in understanding the questions. The study is being carried out in Thai, as it involves participants from 4 regions in Thailand. Although some participants may speak local dialects, the official Thai language is widely understood. The session is conducted by well-trained research assistants and Dr. Sakbunirat, who has extensive experience in community-based research. In the second part of data collection, Dr. Sakbunirat trains registered nurses to extract relevant medical information, such as details about medication use, comorbidities, and history of CVD by ICD-10. During the data collection process, each participant undergoes a physical examination, which includes measuring their blood pressure, taking anthropometric measurements, and performing a 12-lead ECG. Dr. Sakbunirat uses an automated BP monitor following the 2019 Thai guidelines for hypertension treatment. The standard position for BP measurement is maintained, and 4 readings with 1-minute intervals are recorded for accuracy. Anthropometric measurements, including height, body weight, waist circumference, and hip circumference, are taken. A 12-lead ECG is recorded using a 12-channel ECG machine under the supervision of the principal investigator. In addition, laboratory tests are performed to check HbA1c, fasting plasma glucose, lipid profiles, and serum creatinine levels. A registered nurse or medical technician draws blood samples and prepares them for analysis. The specimens are then sent to the central laboratory located at PCM in Bangkok for further analysis. After data collection through the paper-based CRF, it is sent to the Data Management Unit at Phramongkutklao College of Medicine for further processing. Dr. Sakbunirat then transfers the data from the paper-based CRF onto the REDCap platform for systematic analysis. Currently, we have collected data from 12 primary care units in the northeast, 8 primary care units in the south, 8 primary care units in the north, and 2 primary care units in the central. The total number of sampled patients is 828, and the total study participants are 811, resulting in a response rate of 97.9%. As per our timeline, the data collection process is ongoing to cover 36 primary care units nationwide across 4 geographic regions. This study holds substantial promise for enhancing the management of hypertension, thereby leading to improved blood pressure control and reduced CVD complications. The findings of this study may be utilized to advance hypertension management in rural areas of Thailand, aligning with the SDGs Target 3.4, which aims to reduce premature mortality from NCDs by 1/3 through prevention, treatment, and the promotion of mental health and well-being by 2030.
We sincerely thank the JB HACRIT student research work the Phramongkutklao College of Medicine in Thailand and the Martinson Rooker Foundation for generous support of important study.